I'm not veterinary, so I can only go in the ease of direction, or I can go kind of, step by step, and get the consent of the horse to say, hey, is this something we can work on? And I have to gauge the threshold on their ability to sustain that either emotional change, so whether that be as a horse that has had, severe trauma, and I have to, gauge what I'm feeling in my hands, the tissue change, and also watching their expression to say, okay, is this when I back off, or is this where I keep going? Is this a reaction, or is this a, more of, a positive emotion, right? And then a physical threshold, which also ties into the emotional, is say we have a horse with kissing spine. And there's a lot of upper level riders or upper level horses that, they're competing with kissing spine. Sure. And they're managing it. That is just life. And can we avoid it? I have horses that I work on that they had the surgery years ago. And that was, before I was like, hey, maybe we can try to do some in-hand work. We can try to, incorporate body work, whatever, right? It's already been done and said with, and so say that horse has a very high pain tolerance and has a high threshold to what's happened to them. That's when we can have the discussion of saying, okay, maybe your abilities are a little bit greater than the horse who has a very minor kissing spine diagnosis and they think the world is falling apart.
Right. Actually, I'm glad you brought that up, because when I say the show horses that I have, they don't have kissing spine, but that's the situation that we're in.